The Policy Innovation Center's Gender and Inclusion Summit 2023, with theme Building Bridges, Advancing Gender and Inclusion Through the Intersection of Trade and Health, invited the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, for a ministerial interview to discuss the current situation relating to maternal morbidity and mortality in Nigeria. The Minister of State for Health and Social Welfare, Dr. Tunji Alausa, during a panel discussion on reducing maternal mortality in Nigeria, stated lack of coordination, implementation, and others as part of challenges facing the health sector. He emphasized the need for Nigeria to go back to its policy and begin implementation. Dr. Tunji Alausa reiterated the President Bola Ahmed Tinubu's determination to change the narrative.
It's very disheartening what we have in Nigeria, the level of education that we have, how we are as a country. This used to happen to us as a nation. We're being compared, and indicators are being compared to countries like Afghanistan, as our country was several wars in the last 22 decades. They are even better than us. Countries like Ghana, Zimbabwe, Bangladesh, we're spending more money on per capita basis. The indicators are better. We are actually getting worse. We compare the maternal mortality rate from the 2018 data that we have, we doubled. With all the investment, I know you might be complaining that government is not funding us enough, but we pull all the resources coming into the healthcare system, mostly from the complementary resources coming from the development partners. We have enough resources in the healthcare system, but the singular problem here is lack of coordination. Everybody is working inside, and that's what we are determined now to change as a government. Now we are at a pivotal time in the history of our country. We have a President Bola Ahmed Tinubu, that is very determined to change our healthcare system for better, where every single citizen of Nigeria will be entitled to meaningful and comprehensive healthcare. Now, more on the maternal mortality rate. There was a video that the federal media did a few months ago. It's very surreal, but very saddening to see on the average about 88,000 women, young Nigerians, not due to the problem that they caused for themselves. Pregnancy is a joyous event. It is what every family, every woman look forward to. But it's turning to albatross as a nation, where you now have a likelihood ratio of 1 out of 22 young women dying from pregnancies. This is not good. Compared to any advanced economy, where you have a likelihood of 1 in 4,900, it shouldn't be a crime. It shouldn't be a risk to get pregnant, and we're determined to change that. I know you asked me a specific question: why are we here? And you're going to get to what are we doing as a nation, as a nation to change this abysmal data and very bad situation that we're in.
Thank you very much. I really can feel your passion, and I'm excited that we actually have the same passion. And I'm sure we have the same with almost everyone in this room.
Focus myself, turning myself into more of the maternal mortality problem, because we have a whole lot of slew of issues in our healthcare system today. Nigerian problem is not about policy formulation, but it's really good experts and putting policies together, setting up workshops, but the problem is implementation. We have a National Health Act that was enacted in 2014. If from that time to this point, we've been able to implement just 50% of the convention in the National Health Act, a healthcare system far much better than where we are today. So what we're doing now is to go and start implementing each of those components of the National Health Act. Before, many years ago, decades ago, when the government was here, was more of a unitary system. Decisions were made at the federal level because implemented top down. So we had a form of national health system. But as we migrated to civil law, health went on to concurrent lists, which meant state and federal government could do whatever they wanted. There was no serious coordination between the federal government and the subnational government. But the most important thing, which was very remarkable, that the National Health Act achieved, was to go back and form a national health system, where federal government will now coordinate better with the states. Now, I'll tell you one of the things that we just did as a government. Part of the recommendation of the National Health Act was there was a provision for setting up a national tertiary hospital compliance and standard compliance committee. That was there. Nobody did anything. All the checklists was developed. They just put it in the local system. Now we've got it. We implemented that. We have to regulate it. We have to enforce compliance and monitor our care system better. Now, you go back to the primary care system, we're saying, okay, one primary care per ward. That's good. That's a political statement. But one primary system, one primary PAC per ward might not be the same for everybody. You go to Kano, a ward with Kano, every populated ward. One PAC might not suffice for the ward. You go to other places like Bayelsa that might not be that densely populated. You look at it, can one PAC serve a few wards? But then, beyond putting brick and mortar in place, where have we worked everywhere? You'll be so shocked to know that the standing order, the upgrading the ability to treat malaria today at the PAC level was what was developed 12 years ago. It's not been changed. The medications that we use to treat malaria 12 years ago is not what we're using now. And a whole lot of other things. So what we're doing quickly as a government is to reduce this standing order, bring it up to speed to what currently exists, the standard of care using evidence-based approach. We train about 20,000 community frontline workers, which we're going to do in the next few months. We're also looking at providing more funding into our healthcare system. Now, everybody depends on this basic healthcare provision fund, which is 1% of consolidated revenue. Was just about 63 billion last year. It might be about 112 billion in this 2024 budget. But that's not enough. If you look at about 8,000 PACs assessing those basic healthcare provision funds, the average is up to about 3,000 per quarter. The PAC will get about 1.2 million naira a year. We expect them to pay for personal costs, buying plots, starting those PACs. Unfortunately, some of our states, by subnational government as well, they're not doing their counterpart funding into that. So what we're doing now as a government is to coordinate better. Starting this program called sector-wide approach. Talking to our development partners, listen, we know you're here to help us. Let's coordinate. Let's pull some of this money into the honorary fund so that we can direct it to the basic care provision fund through our PACs level. And even if you're not going to pull together with us, tell us what you're doing in your fund so that we can coordinate. If a development partner says, okay, I'm doing this, in Sokoto, then we know we can mobilize some of our own food fund, basic education fund, food fund into other areas. We need to coordinate better.
Thank you. Better coordination.
Speaking on what Nigerians should expect from the ministry, Dr. Tunji Alausa listed a number of programs the ministry has put in place, putting comprehensive approach into consideration. He assures Nigerians the ministry's efforts to put infrastructure in place assures the citizens their commitment.
Obviously, one thing that will change this is our maternal and relative control staff.
And we have that now.
This is one thing that is giving us restlessness. Myself and others that factor. We're working so hard to put sustainable policies and programs in place. And I say carefully, sustainable. It's just not one time. It has to be sustainable. And a lot of things have actually started happening. If you look at our human resources for health, we've just doubled the number of medical students and dental students that we admitted from all allied sector that we admitted in the next academic session. Pharmacists, dentists, nurses, medical laboratory scientists. Now you can tell them that okay, they're just going to be admitted. It's going to take a while. But we're also putting a robust training program in place. And we're actually working also with a huge resource that we have in the diaspora, how we can engage them. And there's several we can engage. There's technology as well. There's telemedicine. We're working quickly to have a national digital platform. These are the things that will quickly take place in the next, before end of next year. And these are enablers that will really complement development, deployment, and sustainability of the robust care system. We're not just looking at it. We're not working on a piecemeal approach. We're working on a comprehensive approach that will be sustainable into the future, 10 years from now, decades from now.
Great. And please give me
the CSOs and development partners is that we need to work together. You have to trust us. You have to trust us and say, trust us government. It's a different government. We have a president that is put his credibility on the line and is made categorical and unequivocal statement that he will fix this healthcare system. Once we begin to trust ourselves, then we will coordinate. Like now, our development partners look at this sectoral approach, and we know things that have happened in the past where funds have not been managed well. But this is different. You have people who stand in the ministry that have credibility on the line. I have my own credibility on the line that this has to work. Corruption will be non-existent in the way we manage this fund. We have to trust. And now also to our civil society, we need you to talk to the children. Please. We know things are bad here. We don't have enough infrastructure in our hospital. But we're working quickly to fix that. We're working hard. There's not going to be too late time to fix it. It will happen very soon. I have confidence in the system. This Japan, people are going to school, nursing school, medical school, with the sole intent of living. No, there's a value, there's a fulfillment, there's happiness in working in your country and serving your people.
Great. Thank you very much. By 2027, if we do not see any improvements, how should we react? We just want to know, because this is a live stage, and if he gives us our words, we really agree with it, but we want to know what to do next if it doesn't happen.
Let me tell you, 2027, if you don't improve, don't worry. I won't be a minister.
Wow.
Mr. Patrick is not a minister. The president would have fired us. He would have fired us. This president, they have a KPI now that we will be evaluated on a 6-month basis. We've signed an agreement with the president. We've signed that contract. These are Delivering these are targets that we're going to achieve. The president has set up the policy coordination unit in the presidency. It is central in the unit that we are monitoring those indicators, not just all ministers. So for job security, we have to deliver. I want to keep my job.
So I would love to have those indicators too, so that we enjoy the coordinating ministry. Thank you all very much. I will really appreciate you. Thank you, sir, for your time.
Comfort Olayinka, Ecohot TV.